My name's Cody. I'm from Section 2. I'm going to go ahead and begin our NG2 placement. So the first thing that you're going to do is you're going to walk into the room, you're going to introduce yourself, and you're going to let Mr. Jones know what you're about to do to him. So, hi Mr. Jones, my name is Cody. I'm going to be your student nurse for the day. I have a doctor's order to go ahead and place an NG2 into your stomach so we can get you some feedings and stuff like that. So, have you had any nausea, vomiting, anything sort of like that? No? You're good? Alright, well I'm going to go ahead and raise you to high Fowlers and we're going to begin. Are you comfortable with this? Yes? Alright. Just let me know if you get uncomfortable at any point in time. Up to high Fowlers, high Fowlers, high Fowlers. Alright. I'm going to raise you back up just a little bit. Alright, good. Okay. So the first thing that I'm going to do is my assessment. So I'm going to go ahead and assess both nares. I'm going to make sure that they are both patent. They are both of equal size. If they're not, I'm going to choose the largest of the one. And I'm going to make sure that there is no loose teeth in the mouth, that the buccal mucosa is moist pink, and that there's no ulcers in the back of the throat as well. So I'm going to go ahead and do this. So looks good. Looks good. Open your mouth for me. Looks good, looks good. Alright, so I'm going to actually go ahead and choose the nare that's closest to me. This one's a little bit larger. Wash my hands. I'm going to put on my gloves. I'm going to go ahead and open up my NG kit, pull it out of its packaging. Go ahead and do this. We're going to go ahead and do our measurements. Alright. So you have your air tube, allows the pressure to come out of line if need be. This piece hooks up to your suction, and we're also going to use this to aspirate the stomach and clear out any clogs if we need to. So, Jones, will you hold that for me real quick? I'm going to go ahead and put a towel right here for you. I'm going to go ahead and give you a cup of water because this can be a little bit uncomfortable. I'll let you know when you need that. Measure from the tip of the nare down the back of the ear as best as we can here. I'm going to come down to the center of the chest, past the xiphoid process, all the way down to the left upper quadrant where the stomach region is. So it looks like we're going to be at about 65 centimeters. So once I have this measurement, I'll go ahead and mark this with a piece of tape. That's going to tell us where we are once we actually put this tube down into the patient's stomach. Okay. Alright, Mr. Jones, I'm going to need you to hold on to this water for me for a minute, okay? I'm going to go ahead and re-lube 4 inches. Alright, I'm going to go ahead and insert this tip into the nare closest to me. Okay. So I'm going to need you to go ahead and tilt your head back for me a little bit. And we're going to go ahead and start this insertion process. Let me know if you feel uncomfortable at any point. Got the 4 inches. I'm going to make sure that it is not coiling in the back of the throat, and then I do see it, and it is back there. There's no coiling. So we're going to go ahead and continue. And at this point, go ahead and take a sip of water for me. Sip of water. Put your head down. Take another sip. Alright, and then swallow as I push through, okay? Alright. And if at any point in time that they feel like they are about to choke or anything like that, you're going to actually pull back on the tube about an inch. Give them a second to recover because this is a painful, very uncomfortable process. So how you feeling, Mr. Jones? You doing alright? Alright, we're going to go ahead and continue. So we're going to advance this all the way down, and this is going to actually go all the way down into the patient's left upper quadrant until we reached our measurement point. Alright, Mr. Jones, now that we got this in place, I'm going to actually temporarily tape this to your nose while I check for placement. So just give me one moment. How you feeling? Are you doing alright? That's a very uncomfortable process. temporarily in. Now I'm going to actually, I'm going to take my syringe. I'm going to check the placement. So I'm going to remove this piece. I'm going to connect my syringe to the tubing. I'm going to pull back, and I'm going to watch for any stomach contents. It's going to be brown or green fluid, which I do see before I press forward. Put this on right. I'm going to reinsert, and I'm going to listen for the gargles. Alright. We are in the correct place. I'm going to disconnect my syringe. Put this guy back in here. We're going to send him off for x-ray. Before he goes, I'm going to go ahead and attach this to his gown so that it does not grab onto anything. So, tie here. I'm going to remove this. You did very, very well. Put this over here and attach this to his gown so that it does not snag and it's out of his way. Bear with me, Mr. Jones. Alright. Place that there. Alright, I will see you in a few minutes, okay? Walk out of the room. Alright, how you doing, Mr. Jones? You back from surgery? Yeah, I'm back from surgery. Alright, everything go well? They actually confirmed that we are in the correct place, so how you feeling? Feeling alright. Alright, cool. We have verified that everything is in working order and we are correct in placement. See you for a second. Grab your tubing. I'll hook you up to your suction machine. I'll put my suction right over there. Alright, you are. During my documentation, I'm going to do that the length in the tubing. How long the tubing was. I'm going to make sure that it did my oral care. So you're going to perform your oral care every 2 hours. Also, I'm going to actually notate the time and date of insertion, as well as actually who inserted the actual tubing. So I'm going to write down the intake and output that I actually used, and as far as the aspiration that I got initially, I'm going to test the pH on the litmus paper if that facility requires it or not. Usually it is not required in hospital settings anymore, but if it is, I would go ahead and actually put some of the aspirant on the litmus paper, document the pH, exactly what the number is, and put it in the MAR. I am also going to go ahead and document the intake and output as well. So anything that I actually took out of my patient, as well as pushed in, I'm going to actually put the amount wasted or used. If you need anything, please go ahead and hit the call bell for me. I'm going to actually lower you down a little bit and get you a little bit more comfortable. Like I comfortable, any nausea, vomiting, or anything of that sort, please hit your call bell. Mr. Jones, heard you're feeling a little bit nauseous. What's going on with you? Just the nausea? Alright, well, let me go ahead and see if I can check the placement, make sure that it is in the correct place, and if it is, we're going to go ahead and clear out your line, make sure that it's not clogged, okay? Is this okay with you? Alright. So, first thing we're going to do is I'm actually going to go ahead and reach over you. I'm going to unhook you from your suction. I'll raise you up just a little bit. Alright. And just bear with me, okay? So I'm going to go ahead and take my syringe. I'm going to insert my syringe into my tubing. And I'm going to aspirate a little bit of the stomach contents. I do see stomach contents, brown and green. Set this here. That's a good sign. And I'm going to push back and listen for the blah blah blah. So, blah, 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 blah. Alrighty, so we are in the correct place. So it looks like you just have a bit of a clog. So just bear with me 1 second. I'm going to come over here. I'm going to draw up about 30 mLs of normal saline. I'm and 30 mLs of normal saline. I'm going to come back over here, reconnect. I'm going to push in that 30 mils of normal saline, and this is going to push out any clogs that might be actually infiltrated into the feeding tube. Once that's pushed, I'm going to pull back more. So I'm going to go ahead and pull back slowly to about 40. Alright, looks like it came through here. Looks like we got the clog. It's actually in the tube here. So I'm going to actually go ahead and disconnect. I'm going to waste this in my waste container. And we're going to rehook you back up to your suction. How you feeling? You feeling a little bit better? Alright, that's awesome. That's awesome. And make sure this is good. We're checking your placement. You're doing your nares. This is all hooked up. There's no kinks in the tubing. Okay. Okay, so now that we have actually cleared out the line, I'm going to actually finish up my documentation. Patient states that he is feeling better and the nausea is subsiding. So in my documentation, I'm actually going to state the intake and output. So I actually flush the line with 30 milliliters of normal saline, at the same time pulling back 40 to 45 milliliters of aspirant from him. I wasted that. I'm going to do the type of irrigation solution and the difference that I actually withdrew and put into the patient, as well as any patient teaching and how well the client actually took this procedure. So once you do patient teaching, you're going to let them know that if they have any further problems, if the nausea vomiting decides to come back, if they're feeling any type of discomfort, to go ahead and hit the call bell. Also, you are going to lower them back down to a semi-Fowler's to a high Fowler's as long as they're comfortable. Just be careful that you don't lower them below 30 degrees because there's going to be an increased risk for aspiration. Okay? You feeling alright, Mr. Jones? Got your TV on? All that? Good? Cool? Alright. Well, go ahead and call me if you need anything. I'll be right around the corner.